You've been with us throughout this crisis, where several weeks ago it was really dire straits in your ER. What's it like now? How's it different?
Thankfully, it is quite different. We're still seeing COVID patients. We're still seeing people coming in that are very sick. But right now, what we're also seeing is we're seeing people start to reemerge. The first time that I had a shift where I saw more non-COVID patients than COVID patients in the last 2 months was just a few days ago. I had a shift 2 days ago where I had a mix of patients with COVID, with complications from COVID, with strokes, with a lot of anxiety, people that are still inside and uncertain about the future. So our patient numbers, thankfully, are down, especially when compared to a couple of weeks ago. But what we're starting to see now is a lot of the complications from people who stayed at home, who are afraid to come to the emergency department, or are having complications of COVID itself.
So, Dr. Spencer, what is your capacity as it stands like? And what do you say to those people that suggest lockdown in the first place was really aimed at preventing healthcare services being overrun? And if that's the case, that reducing the lockdown could perhaps be sensible if indeed healthcare capacity is improved?
I think this was a failure of communication, and that the first part of what we were trying to say, staying at home is important because it decreases the spread of the virus, wasn't translated as well, was translated better than the second part, which was stay home as well during this time so that we have time to ramp up testing, to do the other bread and butter public health that needs to be done so that we can safely reopen when it's time. We did the first part to flatten the curve. A lot of people stayed home to stop the transmission and the virus's spread. The problem is that right now, as soon as we reopen, we don't have what we need in place to be able to do what needs to be done well, the good bread and butter public health, testing, contact tracing, isolating, the things that we need to do, not just now in the coming weeks, but in the coming months and maybe coming years, to make sure we don't continue to have constant interruptions from this virus.
One of the back and forths today in the Fauci testimony came with Senator Rand Paul about reopening schools in the fall. And Dr. Fauci warned about the kids in this country and this newfound disease that they're coming into ERs for. And I'm wondering if you're seeing any of this with Kawasaki-like conditions related to COVID-19.
Yeah, the hospital system that I'm working at has seen a good number of these cases in the past couple of days and the past couple of weeks. These are concerning because, again, up until this point, we thought children, thankfully, weren't really too impacted by this virus. And we know that this is still a rare complication. It's only happening in a very small percentage, we presume. But again, like with a lot in coronavirus, we just don't exactly know. We don't know the risk factors, the predisposing factors that cause some kids to get this and some kids not. We're treating it like we treat Kawasaki-like illnesses, and thankfully, so far, there's been good response. But again, there's still a lot more research that needs to be done on this and everything around COVID, because frankly, there's more that we don't know about this than we do.
So overall, Dr. Spencer, what is your level of optimism of effective treatments that might mean even if there is a second wave, it won't matter too much?
Right now, I think people are getting frustrated and they want something. You know, it's now been months. We need a vaccine. We need treatments. People want to get back outside and get back to a normal life. The frank reality is that right now we do not have a magic bullet. We don't even have any treatments that we know will decrease mortality. Some suggestion in the past couple of days with a new combination, maybe remdesivir will help. Maybe it won't make that big of an impact. We just don't know. We're putting a lot of stake in the fact that in the next couple of months we'll have something that will decrease mortality, decrease hospitalizations, and other great treatments. But again, the reality is that's not true. I think this is also true with vaccines. We have people talking about going back to school in the fall, or maybe by the end of this year we'll have a vaccine. Yeah, maybe that's true. There are multiple right now that are under development, that are in clinical trials. But as you've heard, getting a vaccine that works is only the first part. There are so many other parts that come after that, making sure there's enough vials, making sure we're able to get it to the right people. We don't know how effective it's going to be. What if it's only 60 to 65% effective? What if you need 2 doses? Who do we prioritize first? Healthcare workers and the elderly? There's still a lot of questions and a lot of hurdles that really need to be overcome before we have treatments and vaccines that are actually going to make a significant impact on the shape of this outbreak.
What about you and your team, Dr. Spencer? You've been battling this for now more than 2 months. What has that time allowed you to figure out about how you treat people? In other words, the use of ventilators, the use of specific treatments or techniques, or how quickly you move them into certain places. And do you feel that that time and experience leads you to be more effective in fighting this disease? And we could see, because of that preparation, a lower mortality rate going forward.
Absolutely. So compared to what everyone knew here in New York City, or really in any place that's treating coronavirus patients, compared to what we know now, it's drastically different. We have been trying to put fewer people on ventilators when possible because we knew the mortality was really, really high. We've been trying different positions like proning, so turning patients over on their front, because we think that this helps with their lung respiratory physiology. We've certainly learned a lot. But again, we know that it's only a small number or a small percentage of people that get infected with this virus that get really, really sick. If we have treatment, if we have any other way to prevent this percentage of people from getting sick, that's really the only way that we're going to be able to decrease mortality. This is what we need to be focusing on still, not just reopening, but making sure we're reopening safely, making sure we decrease the spread of this virus. Because again, if we do this wrong, as Dr. Fauci said, it may be that in a couple of weeks or in a couple of months, we're in a worse spot and we've actually regressed because we didn't do this in the right way.